Okay.
Medicare was enacted by Congress in 1965. It covers senior citizens that are 65 years old or older that are covered by Social Security, and people of any age that have been disabled for 2 years or more. Currently, 49 million people are enrolled in Medicare. Medicare is considered an entitlement program. That means that seniors that are currently eligible for Medicare are actually using money that is paid by the current workforce. That's okay for most people because in 50-plus years, when they need to use Medicare, that workforce will, in theory, be able to pay for their care. Unfortunately, there seem to be more cons than pros to the Medicare system as it stands today. On one hand, it does provide coverage for people that wouldn't normally have it. When senior citizens retire, they lose their benefits from their employers, and that often means that they are subject to high premium costs. In this case, with Medicare, their premiums are generally lower. On the other hand, however, there are a lot of downfalls to it. First of all, it only covers short-term hospital care and a relatively small amount of nursing care or home health services, which is something that most seniors may need to use in the future. So it only covers about 90 days worth of hospital stay, and even a smaller amount, or as far as if you need 20 years worth of nursing home care, it'll only cover a small amount of that for each year, and the rest is up to you and your family to cover. Another problem is that not every doctor accepts new patients that are using Medicare because of the way that Medicare reimburses. Medicare has something that they call the allowable amount. That's the amount that Medicare grants for each medical procedure. Once they set that cost, that's pretty much all that they will pay for each procedure. That's against the actual amount, which is what the doctor is going to charge you. The doctor will charge you depending on what state you live in and his reputation as well as that of the facility that you're in. So if you go to a state-of-the-art facility and you get a world-renowned doctor, it's probably going to cost you a lot more than if you were to go to your local care. Unfortunately, like I said, Medicare will only cover your allowable amount, and at that, it's only 80% of that amount. So a lot of doctors don't want to take new patients that are using it. Medicare is also kind of complicated to sign up for. There's 4 different parts that seniors have to sign up for. It's Part A, which is their hospital insurance, Part B, which is their medical insurance, Part C, which is simply the provider that they want to choose to give them those insurance coverage, and then Part D, which is the drug coverage, which is something that most seniors end up needing. As we learned from our video this week, people tend to lose function the older that they get, and a lot of times taking prescription drugs is the only thing that keeps them on a daily basis and the same functioning, so they need that drug coverage. The government has tried using things like the internet to make it a little easier to sign up for. Unfortunately, it brings up more problems. I saw in my research that a lot of people either didn't have the internet because they were senior citizens and didn't feel like they needed it on a daily basis, or if they had access, they didn't actually know how to navigate and how to really use it, and they don't always have a family member that's willing or that's able to come over and help them pick out their care. Finally, Medicare is really costly. It's estimated that the number of people eligible for Medicare will increase by 36% by 2023. That's 18 million people as our population ages. So, in theory, it works on the system of everyone paying it forward, as I showed earlier. The problem is that our workforce might not catch up to that. Currently, in 2012, the cost was just under $450 billion. As of 2023, however, the cost is thought to go up to a little over $1 trillion, and we don't necessarily have the workforce to keep making that amount of money to pay it forward. There are a couple of things that would help fix Medicare as it stands. Unfortunately, a lot of that gets politicized because it does mean that you have to make legislation and pass bills and laws that'll make it better, and a lot of times it gets lost in the political aspect. Some things that would definitely help would be, one, if Medicare had a fixed fee so that doctors always knew exactly how much they were going to be reimbursed. It would help them understand and maybe accept more patients. It would also cut down on fraud. The other thing is if Medicare would grow with the economy and the living wage, which right now it doesn't. And insurance costs continue to grow 2, 3, 4 times the amount of the living wage as well. Finally, it would help if people change their attitude towards senior citizens in general. We need to realize that they are needed and necessary people in our society, and that eventually we're all going to be in their footsteps one day, and that we're going to need Medicare too. So it would be better for everyone if we just pass these laws and change what needs to be changed as soon as possible.